Since cannabis legalization 2.0, there has been an influx of cannabis products available to Canadians. Although all products have a set amount of cannabinoids, CBD and THC, per dose, these products can interact in different ways with the human body due to their varying ingestion methods. Today, we are sharing all of the options you have available to you as a medical cannabis patient. You can choose what products are right for you and how to use them to manage your symptoms while following your dosing strategy from Apollo. Please keep in mind this video is being recorded in May 2021, and the types of products available may vary and are subject to change depending on when you're watching this video. So how do I know which product is right for me? There are two main things to consider when choosing which medical cannabis product to use: the amount of THC, CBD, and maybe other cannabinoids you need for your symptoms, when and how you want to consume your products. All of this is largely related to the condition and symptoms you're trying to treat. One of the main methods of use is ingestion of medical cannabis, and it can be consumed in a variety of forms. When you ingest cannabis, it can take anywhere from 30 minutes to a few hours to take effect and can last anywhere from 4 hours up to 24 hours, although most are between 8 to 12 hours, providing therapeutic benefits to the patient throughout the day so that they don't need to consume cannabis as often. Overall, it can be ingested as an oil, a soft gel, capsule, or as an edible. It's important to recognize that cannabis in a food product, an edible, could act differently from cannabis that's been suspended in an oil or a pill form, depending on how the licensed producer, or LP for short, makes their edibles. Let's start with some new products that have been introduced since Legalization 2.0. Licensed producers now offer chocolates and gummies with just CBD, a combination of THC and CBD, or just THC. Some LPs have teamed up with renowned chocolate makers and companies to ensure that the highest quality products are available for patients. The introduction of edibles has been great not only for patients, but local economies as LPs begin to bring old chocolate factories back to life in smaller communities. Some of the benefits patients are finding using edibles include ease of use, good taste and flavor, discreetness and portability, no risk to the respiratory system, unlike smoking cannabis, and it's simply a great addition to their oils, capsules, and flower products. Legal edibles that are available to both medical and recreational consumers have been capped at 10 milligrams per package or dose by Health Canada, which allows those that are new to cannabis to start with smaller doses. Making sure the products you're purchasing come from the legal market is important for the safety of our patients and those around them. Packaging is child resistant, visually plain, and as per Health Canada's regulations, to keep cannabis away from youths, the gummies aren't in their typical worm or gummy bear shape, and they still taste just as great. The easiest way for our patients to accurately dose their medication is through an ingestible oil or a soft gel. The medical cannabinoids are usually administered or suspended in an MCT oil or ingestible food oil at a set ratio. Because the product is accurately extracted and distributed in the oil, you know the exact amount of milligrams of CBD or THC or both you're receiving with each dose. The oil comes in a bottle and is administered orally with a syringe that has the exact amounts or measurements for precise dosing. Another way to consume oils is via a spray. So sometimes they'll come in a spray bottle like this, which allows for ease of use. Soft gels are very similar to oils, as they are the exact same product, but in pre-dosed amounts. For example, if a patient knows the dose that works for them is 2.5 milligrams, they can opt to use soft gels of that dosage since they are more discreet and can be easier to administer. And they often come in bottles like this one, and as I had shown, they look like that. Start low and go slow with all edibles. Edibles that are infused are digested and metabolized similarly to oils or gel caps. So if you don't know your dose, read the label and make sure to start slow. Wait a few hours before consuming more. Remember, everyone is different and it may affect you faster or slower, so be patient and don't take more than you need. Another new product that is available are sublingual strips, similar to Listerine strips. These strips are the perfect mix between ingesting cannabis and inhaling. They are water soluble, dissolve under your tongue, and therefore are absorbed directly into the bloodstream. It takes about 10 to 20 minutes to take effect and can last as long as any oil or soft gel. Cannabis-infused beverages have also been introduced into the array of medical cannabis products with a variety of sizes, strengths, flavors offered by different LPs. Many of our patients like to drink a beverage to relax instead of drinking a beer. Similar to the cannabis-infused edibles, Health Canada only allows a maximum of 10 milligrams of THC per drink, with many drinks being CBD only or a low dose of 2 milligrams of THC per drink. Currently, there is a variety of soda-based, fruit-flavored, and sparkling water beverages available for patients. These refreshing cannabis-infused drinks are easy to drink, ready to go, with a consistent cannabis experience every time. Patients also have access to teas with small amounts of caffeine or caffeine-free options, which come in a variety of flavors. Each pouch comes with one or a few tea bags, and each LP offers different doses per tea bag. Always read the packaging to know what you're taking and dose appropriately. It is suggested by most LPs to steep the tea for about 3 to 5 minutes, and these teas are infused with cannabis oil, CBD isolates, or cannabis-infused sugar in each bag. There are other edible products as well, such as emulsified decarboxylated powders. Decarboxylation is a heating process that activates the cannabinoids in a cannabis plant. These powders can be mixed into your own beverages and teas for ease of consumption, or can be placed into your own capsules. This ingestion method differs in our bodies from food or fat-based edibles, as they are water-soluble and works similarly to how alcohol is absorbed in our bodies. This is why it has a quicker onset time. The effects may be felt in as little as 30 minutes and could last as long as 24 hours. Typically though, 4 to 12 hours. So remember to always start low and go slow. The other main method of consumption is through inhalation of dried cannabis flower or oil extracts through vape pens. Cannabis flower is where all cannabis medication comes from and houses all of the cannabinoids within microscopic trichomes on the outside of the flower. They often come in these kind of containers. When you inhale cannabis, you feel the effects within 5 to 10 minutes, if not sooner. However, the effects do not last as long, usually up to 4 to 5 hours. So we typically recommend this one on an as-needed basis. Since Apollo is a medical clinic, we advise that patients choose to vaporize dried flower versus smoking it. Whenever you vaporize, you get more of the cannabis plant and it's safer on the lungs. Vaporization has grown in popularity since Legalization 2.0. To be clear, we are discussing medical cannabis devices and not any vaporizers with nicotine or those that are sold in places such as convenience stores. Currently, there are 2 different main types of medical cannabis vaporizers: dry oven flower devices and pre-filled cartridges that are attached to battery packs. Having been around for many years prior to legalization, dry flower or oven vaporizers are used with either cannabis flower or a concentrate to produce a warm mist that contains the cannabinoids and does not burn the product or create carcinogens. There are a wide variety of options when it comes to dry flower vaporizers, with a few of them being recognized by Health Canada as a medical approved device, such as the Mighty Medic. This inhalation method is beneficial to patients who are looking for immediate relief from quick onset conditions and symptoms such as migraines, PTSD, chronic pain, anxiety, and so much more. Apollo carries a wide variety of the medical devices and can provide you with assistance on how to use your device and how to dose properly. The second type of vaporizers are pre-filled cartridges sold by licensed producers. These cartridges, also called carts or vape pens, come pre-filled containing an amount of pure cannabis extract that is easy to use and great for those on the go. While the cartridges are disposable, you will need your own battery pack to operate them. Before purchasing, ensure that your battery and cartridge contain the same attachment mechanism, such as the popular 510 thread, which looks like that and attaches to this. Licensed producers may also sell all batteries to go alongside the cartridges if you need one. To use, attach or screw on the cartridge, such as this one, to the battery. Like that. Make sure the battery is charged and slowly pull or breathe in on the device. Another example is this one. All right, and you can put the cartridge on like that. Similar to all other medical cannabis products, each cartridge is labeled by the licensed producer and contains information such as strain type and milligrams of CBD or THC. The dry oven vaporizers often have more options in terms of heat settings and the ability to use different strains or even mix them when needed, offering more flexibility for your medication needs. So concentrates are what they sound like, a concentrated form of cannabis that is higher in strength. It is extracted from cannabis flowers, and a little goes a long way. Patients living with certain medical conditions may benefit from the immediate onset time with inhalation of concentrates, as well as the strength and concentration of those products. Resins can be consumed using a vaporizer that is compatible with concentrates, such as the Utilian 722 or the ever popular PAX 3, which we carry here at Apollo. There's also a method called dabbing, which involves the use of a high heat and contraption called a dab rig. With resin or hash, like all cannabis products, start low, go slow. Always start with a small amount and wait to see how you feel before consuming more. These highly concentrated products are not suitable for cannabis-naive patients. Topicals or infused creams have grown in popularity among patients with skin-related issues and those with inflammation close to the skin, such as arthritis in the hands. Topicals are cannabis-infused creams, lotions, lubes, or other products intended to be applied to one's skin and absorbed through the skin. Recently, we also saw the introduction of bath bombs, similar to this. One of the features of topical products that many favor is that you typically do not feel any intoxication due to the THC not being able to enter the bloodstream. Because of this, these products contain a much higher level of THC than some of the other options we previously mentioned. There is a set limit by Health Canada of 1,000 milligrams per package. Patients may use topicals for conditions such as arthritis, pain relief, eczema, and psoriasis. Some patients opt to make their own cream, creating homemade remedies or products. However, there's still more research needed to understand the efficacy and effectiveness of using topical creams. These creams and products may contain other chemicals and ingredients often found in other creams, and it is always best to check the ingredient list before purchasing. When looking for relief from inflammation, beneficial ingredients can include aloe vera, ginger, and turmeric. It's always important to wash your hands well after applying a topical in order to not accidentally touch your mouth and ingest any of the cannabinoids. At Apollo clinics, topicals may be recommended for patients who cannot consume any cannabis or cannot inhale it either. So I'm going to end this presentation with a hypothetical situation to illustrate how some of the methods can be used. We have a patient, a 35-year-old female suffering from chronic migraines. She has them up to 1 to 2 times a month, but no consistent pattern to them. When she does have a migraine, they normally last up to 3 days. In this case, her pain is unpredictable, and when it does happen, she would need something right away. So she can then vaporize something as soon as she feels a migraine coming on, or an aura, to help stop the pain or prevent the pain. Then she can use a dose of cannabis oil or soft gel to maintain pain relief throughout the day so that she's not constantly needing to vaporize. Some of our patients experience more frequent migraines and will use cannabis oil more consistently to prevent the onset of their migraines and vaporize as needed for breakthrough pain. So as you can tell, there are many ways to tackle your symptoms. We hope we were able to share some new knowledge with you on all of the options available to you as a medical patient. One of our goals at Apollo is to educate our patients so that they're able to make informed decisions when it comes to their healthcare and medicinal cannabis options. Our support team can help you choose the right products, get you started on dosing, and guide you along the way. If you have any questions regarding the products we've discussed today, please feel free to send questions to marketing@apolloresearch.ca or leave them in the comments below. We offer free virtual appointments across Canada, 7 days a week, and we hope to see you soon. Thank you.